As we age, the body doesn't fail suddenly. It whispers first, and one of the earliest whispers after 75 is weakness in the muscles, thinning bones, slower healing, and poor absorption of nutrients that once sustained us effortlessly. Many people believe eggs are the ultimate protein for seniors, but orthopedic surgeons who work daily with aging bones and muscles see a deeper truth. After a certain age, it's not just about protein quantity, but protein absorption, mineral delivery, and how gently the food works with digestion. And this is where one humble traditional food quietly outperforms eggs. That food is aged. Natural cheese, especially varieties like raw cheddar, Parmesan, or aged goat cheese. Here's why this matters. After age 75, stomach acid naturally declines. Research published in the American Journal of Clinical Nutrition shows that low stomach acid dramatically reduces the absorption of protein, calcium, magnesium, and vitamin B12. Eggs, while nutritious, require stronger digestive power to break down fully. If digestion is weak, much of that protein passes through unused. This is why many seniors eat well yet continue losing muscle, a condition known as sarcopenia. After the age of 75, the body does not suddenly give up, but it quietly changes the rules, and most people are never told that the real enemy of strength is no longer aging itself, but silent malnutrition caused by poor absorption. Medical journals have shown that by the late 70s, stomach acid can drop by more than 50%, and without adequate acid, protein, calcium, magnesium, iron, and vitamin B12 simply cannot be broken down or absorbed, no matter how healthy the diet looks on paper. This is why so many older adults eat well, follow doctor-approved diets, and yet still watch their muscles shrink, their legs weaken, and their bones thin year after year. Sarcopenia, the medical term for age-related muscle loss, affects more than half of people over 75, and research published in the Journal of Gerontology confirms something shocking. Muscle loss accelerates not because the body forgets how to build muscle, but because it no longer receives usable building materials. The muscle machinery is still there waiting, but the delivery system has failed. Protein that once fueled strength now passes through undigested, unused, and wasted. Orthopedic surgeons see the consequences of this every day. Hip fractures, spinal compression fractures, slow wound healing, and loss of balance are not random events. They are the final stage of years of nutrient starvation at the cellular level. Studies show that low protein absorption directly correlates with increased fall risk, longer hospital stays, and loss of independence. This is not about vanity or youth, it is about survival and mobility. Eggs are often praised as the perfect protein, but after 75, perfection on paper does not equal performance in the body. Eggs require strong stomach acid and digestive enzymes to release their amino acids, especially leucine, the key trigger for muscle protein synthesis. Research from clinical nutrition shows that older adults absorb significantly less leucine from whole eggs compared to younger individuals, even when eating the same amount. The protein is present, but the body cannot unlock it. This creates a cruel illusion. Seniors believe they are doing everything right. They eat eggs for breakfast, drink milk, maybe even add protein shakes, yet muscle continues to disappear. The problem is not effort, the problem is physiology. Aging digestion is not a moral failure, it is a biological reality. Even calcium, often consumed diligently through dairy or supplements, becomes ineffective without proper absorption. Low stomach acid and reduced vitamin K2 mean calcium floats aimlessly in the bloodstream instead of embedding into bone. This is why studies repeatedly show that high calcium intake alone does not prevent fractures and may even increase arterial calcification. The body is overwhelmed with nutrients it cannot place correctly. One of the most alarming findings in geriatric research is that malnutrition in older adults is often invisible. Blood tests can appear normal while muscle tissue is starving. The body prioritizes vital organs like the heart and brain, quietly sacrificing muscle and bone to keep those organs alive. By the time weakness is obvious, years of damage have already occurred. This is why orthopedic specialists emphasize absorption over intake. They know that rebuilding strength after 75 requires foods that are partially digested, mineral-rich, and biologically gentle. The digestive system at this age cannot be bullied into performance, it must be supported. Fermented and aged foods outperform fresh, dense proteins, not because they are stronger, but because they are easier. Research on older populations consistently shows that when protein is delivered in an already broken down form, muscle protein synthesis can be reactivated even in the late 80s. This is a powerful truth rarely shared outside medical circles. The aging body still responds, it still rebuilds. It simply needs nutrients it can recognize and absorb. Loss of muscle is not just about weakness. Muscle is a metabolic organ. As muscle disappears, blood sugar regulation worsens, insulin resistance rises, inflammation increases, and immune strength declines. Studies show that sarcopenia doubles the risk of hospitalization and significantly shortens lifespan. Muscle loss is not cosmetic, it is life-altering. The tragedy is that most people are told muscle loss is normal, inevitable, and irreversible. Yet controlled studies show that when absorption improves, muscle mass can stabilize and even increase. The body has not forgotten how to heal. It has been deprived of the tools. Orthopedic surgeons often describe aging bones and muscles as hungry but ignored. They are desperate for nutrients that never arrive in usable form. This is why simply eating more does not work and can even worsen inflammation and digestive distress. Quality and bioavailability matter more than volume. The science is clear and unsettling. After 75, the digestive system changes faster than most diets adapt. This mismatch creates a slow, invisible decline that is mistaken for aging itself. But aging is not the root cause, poor absorption is. Understanding this changes everything. It shifts the focus from fighting the body to working with it. It replaces blame with strategy. And it reveals that strength, balance, and independence are not lost overnight. They are quietly starved away. When absorption is restored, even partially, the body responds with gratitude. Muscles regain tone, balance improves, and bones receive the minerals they have been craving for years. This is not a miracle. It is biology finally being respected. The first step to ending sarcopenia after 75 is not lifting heavier weights or forcing more protein. It is acknowledging the truth that the body is not broken, it is undernourished at the cellular level. And once that truth is addressed, decline is no longer inevitable. After the age of 75, the question is no longer which food looks best on a nutrition chart, but which food the body can actually use. And this is where aged, natural cheese quietly surpasses eggs in a way most people never expect. Orthopedic surgeons who repair fractures and treat muscle wasting see a pattern repeated thousands of times. Patients who consume adequate calories and protein still lose muscle and bone because the nutrients never reach their destination. Science confirms this uncomfortable truth. Bioavailability matters more than intake, and fermented aged cheese delivers nutrients in a form the aging body can finally recognize. During the aging process of cheese, time does something remarkable that human digestion often can no longer do efficiently. Proteins are partially broken down into smaller peptides and free amino acids, meaning the body does not need strong stomach acid or aggressive enzymes to access them. Research published in Nutrients shows that older adults absorb amino acids more efficiently from fermented dairy than from whole, unfermented protein sources like eggs or meat. This is not opinion, it is measurable biology. One amino acid changes everything for aging muscle, and that amino acid is leucine. Leucine is the ignition key for muscle protein synthesis, the signal that tells muscle cells to rebuild instead of shrink. Studies from the American Journal of Clinical Nutrition reveal that aging muscles become resistant to this signal, a phenomenon called anabolic resistance. Eggs contain leucine, but aged cheese contains it in a more readily absorbed form, meaning the signal is louder, clearer, and more likely to be heard by muscle cells that have grown stubborn with age. Orthopedic surgeons understand something else that nutrition labels do not show. Muscle and bone are inseparable. When muscle weakens, bones lose protection. When bones thin, muscles shut down out of fear. Aged cheese delivers calcium already bound to protein and fat, improving absorption and reducing the risk of calcium being misplaced in arteries. But the true magic lies in vitamin K2, a nutrient nearly absent from eggs yet abundant in aged cheeses. Vitamin K2 is not optional after 75, it is essential. Without it, calcium cannot be directed into bone tissue. Instead, it accumulates in blood vessels, contributing to stiffness and heart disease. Studies from Osteoporosis International show that higher K2 intake is associated with stronger bones and significantly fewer hip fractures in older adults. Orthopedic surgeons know that a hip fracture after 75 often marks the beginning of rapid decline, loss of independence, and shortened lifespan. Preventing that fracture is not dramatic medicine, it is quiet nutritional strategy. Aged cheese also contains conjugated linoleic acid, or CLA, a naturally occurring fat shown to reduce inflammation and preserve lean muscle mass. Chronic inflammation accelerates muscle breakdown and joint degeneration, a fact well documented in geriatric research. Eggs provide fats, but they do not offer this fermented anti-inflammatory compound. For aging joints and muscles already inflamed by years of wear, this difference is not small. It is decisive. Another overlooked advantage is digestion itself. Many seniors unknowingly suffer from protein intolerance, bloating, or discomfort not because protein is harmful, but because digestion is weak. Aged cheese contains natural enzymes and beneficial bacteria that support gut health. A healthier gut improves nutrient absorption, immune function, and even balance. Research links gut microbiome diversity with reduced fall risk, something orthopedic surgeons track closely because falls are often the true cause of fractures, not brittle bones alone. Then there is vitamin D, often discussed but rarely absorbed properly. Fat-soluble vitamins require fat for absorption, and aged cheese naturally delivers vitamin D alongside healthy fats, improving uptake. Eggs contain vitamin D too, but when digestion is compromised, fat digestion suffers and absorption drops. Aged cheese simplifies the process, offering nutrients in a form that requires less effort from a tired digestive system. What shocks many people is how little is needed. Studies show that as little as 30 grams of aged cheese can significantly stimulate muscle protein synthesis in older adults when consumed consistently. This is not about overeating or indulgence. Orthopedic specialists emphasize that small regular portions outperform large sporadic ones. The aging body thrives on predictability, not extremes. Timing matters as well. Muscle repair accelerates during sleep, and research suggests that consuming easily absorbed protein in the evening supports overnight muscle synthesis. Aged cheese, eaten before bed with minimal digestive burden, provides a slow, steady release of amino acids during the body's natural repair window. Eggs, by contrast, often digest too slowly or incompletely, disrupting sleep or failing to deliver nutrients when they are most needed. Quality is everything. Traditional aged cheeses made from real milk, salt, and cultures retain their enzymes and nutrients. Highly processed cheeses do not. Orthopedic surgeons and nutrition researchers consistently warn that food processing removes the very elements that make foods therapeutic. The difference between real aged cheese and processed cheese is the difference between nourishment and empty calories. What makes this discovery emotionally powerful is not the food itself, but what it represents. It proves that decline after 75 is not inevitable. The body does not suddenly lose its ability to rebuild muscle and bone. It loses access to usable materials. When those materials arrive in the right form, the response can be dramatic: improved strength, steadier walking, less pain, and renewed confidence. Muscle is not just about movement, it is a metabolic engine. Preserving muscle improves blood sugar control, reduces insulin resistance, and strengthens immunity. Studies show that seniors with higher muscle mass live longer, recover faster from illness, and maintain independence. Aged cheese supports this entire cascade, not through hype, but through biochemistry aligned with aging physiology. Orthopedic surgeons rarely speak in absolutes, but many quietly agree on this point. After 75, fermented, aged dairy often outperforms perfect proteins like eggs because it works with the body instead of demanding performance it can no longer deliver. This is not a rejection of eggs, it is an evolution of strategy. The most sobering truth is that muscle loss is reversible, longer than we were once told. Research on adults in their 80s shows that when bioavailable protein, calcium, and K2 are introduced, muscle mass can stabilize and even increase. The window does not close at 60 or 70. It narrows, but it remains open. Aged cheese does not promise youth. It offers something far more valuable: strength without strain, nourishment without overload, and repair without struggle. In a body that has worked hard for decades, this gentleness is not weakness. It is wisdom. After 75, the body does not rebuild through food alone, and it does not strengthen through movement alone. It requires a precise conversation between nourishment and motion, and when that conversation is restored, something extraordinary happens. Strength begins to return. Scientific research is clear that muscle is not passive tissue. It is a living organ that waits for two signals before it will grow again. The first signal is nutrition, and the second is movement. Without both, muscle stays silent. With both, even an aging body responds. Studies published in the Journal of Applied Physiology show that muscle protein synthesis in older adults can increase by more than 40% when easily absorbed protein is paired with gentle resistance or walking. This is not elite training. This is not heavy lifting. This is the body remembering what it was designed to do. Yet millions of seniors are told that weakness is unavoidable, that slowing down is natural, and that rest is safer than movement. Orthopedic surgeons know this advice, while well-meaning quietly accelerates decline. When muscle weakens, balance deteriorates. When balance deteriorates, fear increases. When fear increases, movement decreases. This downward spiral is responsible for more fractures than fragile bones ever were. Research shows that the majority of hip fractures occur not because bones suddenly shatter, but because muscles failed to stabilize a simple movement like standing, turning, or stepping. Muscle is the body's first line of defense against injury. Gentle movement sends a biological message that food alone cannot deliver. When muscles contract even lightly, they release signaling molecules called myokines. These molecules communicate with bones, the brain, and the immune system, telling the body it is still alive, still active, still worth maintaining. Without this signal, nutrients drift without purpose. With it, nutrients are directed exactly where they are needed. Orthopedic research consistently demonstrates that even short daily walks reduce fracture risk, improve joint lubrication, and preserve muscle mass. A study in The Lancet revealed that seniors who walked just 20 minutes a day had significantly lower mortality rates than those who remained sedentary, regardless of age. Movement is not exercise in the traditional sense after 75. It is communication, but movement without nourishment is exhausting. This is where many seniors fail unknowingly. They attempt to move more but lack the nutritional support to recover. Muscles break down faster than they rebuild, leading to soreness, fatigue, and discouragement. The body learns the wrong lesson. Movement hurts. In reality, movement without fuel hurts. When nourishment is present, movement heals. Consistent nourishment matters more than occasional effort. Research shows that muscle responds better to regular, modest protein intake than to large, infrequent meals. The aging body thrives on rhythm. Small daily portions of bioavailable nutrients provide a steady supply of amino acids, calcium, and vitamins, allowing repair to occur quietly and continuously. Orthopedic surgeons emphasize consistency because they see the consequences of sporadic care injuries, setbacks, and loss of confidence. Timing also plays a powerful role. Muscle repair peaks during sleep, particularly during deep sleep phases. Studies show that consuming easily digested protein in the evening supports overnight muscle synthesis, improving strength and function over time. This is why late-day nourishment paired with light movement earlier in the day creates a full repair cycle. The body moves, then it rebuilds. What surprises many people is how quickly the body responds when this cycle is respected. Within weeks, seniors often report improved balance, easier standing, and less joint pain. These changes are not placebo. They are measurable improvements in neuromuscular coordination and muscle fiber activation. Research confirms that muscle fibers do not disappear entirely with age. Many simply become dormant. Movement wakes them up. Nutrition feeds them. Fear is the greatest obstacle. Fear of falling, fear of pain, fear of overdoing it. Yet studies show that inactivity increases fall risk more than gentle movement ever could. Muscles weaken faster when unused, and reflexes slow without practice. Orthopedic surgeons frequently observe that patients who avoided movement out of caution often suffer the most severe injuries later because their muscles could no longer protect them. The emotional cost of muscle loss is rarely discussed. Loss of strength leads to loss of independence, and loss of independence leads to isolation and depression. Research links sarcopenia with cognitive decline, not because muscles think, but because movement supports brain health. Walking increases blood flow to the brain, stimulates neuroplasticity, and reduces inflammation. Muscle health and mental clarity are deeply connected. Gentle resistance, such as standing from a chair, light band exercises, or controlled stair climbing, signals bones to strengthen as well. Bones respond to pressure. Without it, they thin. With it, they adapt. Studies in bone journal show that weight-bearing movement increases bone density even in advanced age when combined with proper nutrition. This is not about reversing age, it is about slowing decline and preserving function. Consistency transforms identity. When seniors move and nourish daily, they stop seeing themselves as fragile. Confidence returns. Confidence changes posture. Posture changes balance. Balance prevents falls. This cascade is well documented in geriatric rehabilitation studies, yet rarely emphasized in everyday health advice. The most shocking truth is this: many people lose strength not because their bodies are incapable, but because they were never shown how to work with aging physiology. The body after 75 does not need punishment, it needs partnership. Gentle movement tells the body to stay alive. Nourishment tells it how. Orthopedic surgeons often say that independence is built long before a walker is needed. It is built with daily habits so small they seem insignificant. Walking, standing, nourishing, resting. These habits compound quietly, just like decline does. But unlike decline, they work in the direction of life. Muscle, bone, balance, and confidence are not lost all at once. They are lost when the conversation between movement and nourishment breaks down. Restore that conversation, and the body responds with resilience that surprises even medical professionals. This is not about becoming young again. It is about staying capable. It is about standing up without fear, walking without hesitation, and living without constant limitation. Science confirms what the body has always known. When movement and nourishment work together, strength does not disappear. It adapts, waits, and returns.